What can you tell me about cholesterol?
Well, that's a very interesting question. The way I would like to describe cholesterol is every time somebody comes and asks me, hey, what do you think about cholesterol? I ask them, what's your cholesterol? The first thing they come and tell me is, my cholesterol is 200, it's above 200. It's a magical number. What does it really mean? It doesn't really mean anything. What really means as a cardiologist, I always worry about if there's a good cholesterol and there's bad cholesterol and what's the ratio. If you look back at all the cardiology textbooks, if you go all the way back, even 20, 25 years, the best predictor of badness to happen is a combination of a ratio of the total cholesterol divided by the good cholesterol and combining it with something called the CRP. People, you've heard about the CRP. CRP is what? So I'm going to touch base on all of that. So I'm going to touch base on total cholesterol, good cholesterol, bad cholesterol, and CRP in a more mundane fashion. So let's all correlate it to, bottom line is when you have a murder in any kind of city, think about it like it's a heart attack or a stroke. So you have a badness, some bad event happened, am I right? So our goal is to prevent that. Okay, so what is the chance that you have badness happening in New York City versus what is the chance of badness happening in a small town like Carnegie, Oklahoma? What is your mindset? Your mindset initially says, New York City, too many people out there, right? So there's definitely going to be crime. There's a higher chance you're going to find murder. Who knows? The chance of murder might be a lot higher in Carnegie than in New York City. Why? So the New York City population is huge. So our first concept is, oh my God, you mean New York City has to have more crime? Oh my God, my cholesterol is so high, I'm going to have a heart attack. It doesn't correlate all the time. So what happens? How many bad guys are there? So how many bad guys are really there in New York, right? Then you look at that. The other concept is, okay, New York has a lot of population, has a lot of bad guys, but how many good guys are there to protect the city, right? So if the New York Police Department is a lot stronger in relation to the number of bad guys in New York, you're going to have less crime. If you have Carnegie, Oklahoma, which might have 5,000 people, citizens, and you have one cop managing the whole town, you're going to have more crime, right? So similarly, you might have what you would call cholesterol less than 200, but if your HDL is pretty darn low, you're going to be at a pretty darn high risk to have, any kind of a bad event. So one number doesn't give you the whole aspect of what's good cholesterol, what's bad. It's a combination of numbers. It's not like, oh my God, I'm a cardiologist. No, it's a combination. One number doesn't do it. So then what on earth is a CRP? Now CRP is actual measurement of how much commotion there is. It's like kind of testing the temperature, of the water. Hey, how good it is. So when the CRP is high, that means your whole body is inflamed. Already a lot more commotion happening. So if you have more bad guys, you have less good guys, and more commotion, guess what? Your risk goes up significantly. You see what I'm trying to say? So if you put that all into terms, then you say, okay, now tell me, what's your cholesterol? Then you ask yourself, what's your total cholesterol? How much, what's your HDL, which is your good cholesterol? So do you have a good enough police department in your body? And what's your CRP? Is it low enough? Right? So what do? We take medications. Why? What do we take the medicines for? We try to eliminate the number of bad guys. Try to get it down as low, because then you don't worry about the good guys. Because it's very hard to find good guys. Is that right? It's very hard to get the HDL up. It's extremely hard. There is no medicines to get the HDL up. There's probably one, niacin. But again, when you look at all this, oh my God, my HDL, this medicine increases HDL by 20%. What is 20%? What is 20% of 30? It's 6 points. So from 30 to 36, it doesn't do anything. For a male, you need to have a HDL at least above 40, right? So just like real life, it's very hard to get good guys. It's very hard to get the HDL up. You can always eliminate the bad guys. So right now, it's easy to get. You take a statin drug, you get the LDL down. You take a PCSK9, the newer injectables, you get the LDL down. So at least you minimize the risk. So if you get all the bad guys down, you minimize the risk. Interestingly, the statin drugs decrease the CRP as well. So they decrease the commotion in the city. They make the city calmer. So it's a double whammy. You get the bad guys down, the commotion is down, your risk is down. So that's why statin therapy has been so good all along. And now that's why PCSK9 is just up on the top, because PCSK9 PCSK9 is like taking a jackhammer and you're just eliminating all the bad guys. So